All right, can you all see my screen okay? Yes, amazing. Well, hi everyone. Thank you so much for joining this webinar today. My name is Clarissa from the Society for Public Health Education, and I would like to officially welcome you all to this webinar addressing arthritis, determining your organization's readiness to deliver AAEBIs in partnership with the CDC and the YMCA of the USA. The Society for Public Health Education is an inclusive organization of health professionals, and we welcome your whole self. SOPHI's mission in supporting leaders in health education and promotion to advance health equity in communities across the globe. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. On behalf of SOPHI, we are pleased in the interest in today's webinar and are thankful that you have taken the time out of your day to participate. We would also like to acknowledge the support from partner organizations from the YMCA of the USA and CDC. Before I introduce our speakers today, I'll just like to go over some very brief housekeeping rules. So please note that all attendees are muted for today's webinar. After hearing from our presenters, you'll have a brief question and answer session with the time remaining. And questions can be submitted anytime during the chat, and you are more than welcome to unmute yourself whenever we get to the Q&A portion. This session has enabled automatic closed captioning. To add closed captioning, click on the CC button in your Zoom taskbar to ensure subtitles. Please feel free to rename yourself and include your organization if you have not done so already. You may also use reactions at any time during the presentation. And now I am excited to introduce today's speakers. So I would like to introduce Heather Hodge and Mamta from the YMCA of the USA. Heather Hodge is the Senior Director of Equity, Access, Engagement, and Health Approaches at the YMCA of the USA. In this role, Heather provides support for the WISE effort to help all community members live their healthiest lives through improved lifestyle, health, and health outcomes. Through public/private partnerships, the WISE are strengthening the foundations of community by providing membership, programs, and services to address factors impacting health outcomes, like socioeconomic factors, physical environments, and health behaviors. During her more than 20 years with the Y, Heather has led efforts to strengthen Y support of individuals and families who struggle to adopt and maintain healthy lifestyles while demonstrating cost savings and improved health, resulting in reimbursement for Y program delivery and outcomes. Specifically, Heather has been responsible for the implementation of nearly $5 million of federally funded efforts to support arthritis management, with an extensive emphasis on enhanced fitness program model. Heather received a BA from Butler University and a Master's of Education from DePaul University. In her free time, she loves to travel and enjoys watching college basketball. Go Bulldogs. Now, Mamta is the Director of Health Equity, Access, and Engagement, also at the YMCA of the USA, where she supports local YMCAs in their ability to serve community through partnerships and collaborations, equity approaches, and direct services, including those related to chronic disease prevention and management. Now it is my pleasure to turn it over to Heather and Mamta. Thanks, everyone.
Thanks so much, Clarissa. I apologize, everyone. Next time I'll make sure the super short bio is in. But appreciate that. Yes, and if any of you are college basketball fans, hopefully you all enjoyed what was definitely a wild tournament in the men's bracket with a lot of exciting games and upsets. So with that, thank you so much for having YMCA of the USA participate. Mamta and I are thrilled to be able to talk a little bit about organizational readiness for AAEBIs. I know this has been a series, so you've gotten to hear from some of our other national organizations who have been working to support sustainability or helping you think through how you deliver your programs remotely. or even, other elements of readiness, we decided to focus a little bit about how you might work within your organization and within your community to determine readiness to deliver AAEBIs. So with that, if we can go to the next slide. So the biggest thing that we always try to work with YMCAs on has to do with community need. And I'll just say one thing briefly before we kind of get into the meat of the conversation. YMCA of the USA is the national resource office that supports the 770 501c3s that make up the YMCA network. So here in the US, I should say, we're part of a global network, but YMCA of the USA supports Ys in the US. And that is a big footprint, both in terms of physical locations, but also in terms of our ability to deliver programs and services in person or remotely via distance learning models. And we have local YMCAs. You might be in a community that has one YMCA that is its own independent 501c3 or is a branch of a larger association. And nearly all of you likely live in states that also has something called a state alliance. And I think I saw Martha from New York on the participant list. So hi, Martha. But that means that we also have alliances that operate at the state level and maybe good connection points for you as well, because they provide support to YMCAs in that state around a variety of topics, and oftentimes are critical to partner relationships across a state or a given region. So when we start to talk about organizational readiness, we want to focus in on community needs. So if you go to the next slide, we obviously need to ground our conversation in those drivers or needs in the community that impact an individual's ability to live in a healthy manner and a healthy lifestyle within their community. And that means we're looking at the social determinants, whether you say determinants or drivers, or in our case, oftentimes we talk about the social needs that YMCAs work to address. We want to make sure that where people are born, grow, live, work, et cetera, age, helps improve their health status over time, isn't a harm to them. And obviously, we know by virtue of all you on this call likely have been seeing a lot of these inequities in health play out with the individuals you're trying to support and reach with arthritis appropriate evidence-based health interventions. So we really need to begin by looking at the communities we serve, understanding the factors that are both facilitators and barriers to program participation before we start to think about even our own organization's readiness to advance a program model. So if we go to the next slide, here, we often use, it depends on which model of social determinants you're looking at. Oftentimes we tend to gravitate towards Kaiser Family Foundation's model here. But YMCAs as a community organization oftentimes are delivering services or working across all of these pillars of social determinants, whether we're helping as an employer ourselves or so under economic stability, or some YMCAs do have transitional housing, or we support transportation. We try to move transportation as a barrier to programs and services, whether we're doing workforce development or education, anti-hunger and feeding program efforts, looking at the ability to engage in that community and social context, as well as healthcare system supports. We're trying to find as many ways to improve those health outcomes in our communities as possible. And we oftentimes try to map the services that are provided in a given region through the Y or in partnership with a network of community-based organizations, looking at where can we help make sure individuals have the best access to services and care that supports those improved health outcomes that we're all striving towards. So we go to the next slide. Maybe you all have seen this before. We like to talk about this in the Y quite a bit, is obviously 80% of health happens outside of the clinical environment. And we use this quite a bit. And in fact, we have a monthly call that focuses in our peer communities around chronic disease programming and social determinants of health. And we spent some time talking about this yesterday and starting to look at, In the why, how do we address all of these markers, including sometimes, and we do sometimes work in the healthcare 20% because we're helping to get folks access to care where possible. But then also, this is a good exercise to work across your community. Who is supporting and addressing a lot of these factors, whether it's tied to socioeconomic factors, physical environment, those health behaviors, or healthcare? How do we develop those community resources and networks in order to address factors that impact health outcomes overall? So, encourage you, if you haven't spent a lot of time thinking about this thinking about how your organization can contribute in this way, I encourage you to do so. So our next slide should take us to, we want to talk now about the foundations that are essential for program implementation or service implementation, especially when it comes to AAEBIs. So if we go to the next slide. In the why we talk, and obviously as we're thinking about AAEBIs as well, evidence-based programs, right? So these are programs or practices usually that have an evidence base behind them, not just the output. So we want to look at, have these program models been peer reviewed? Obviously, in the space of AAEBIs, CDC has done a lot of work. There are multiple program models, whether they're focused on physical activity or exercise, whether they're focused on the lifestyle change supports. We know that there is an extensive list of programs in this space. Where the reason we talk about this a lot in the why, and this might be helpful for your organization as well too, is when you're delivering evidence-based programs, there is a certain set of criteria or expectations, like fidelity to that program model, that's really critical. So we try to put this in a picture to help organizations like YMCAs understand when we talk about programs being scalable. We've been testing them in multiple, YMCAs. If a program works in one Y, we don't necessarily assume it works in every Y. We need to understand that nuance. Again, we need to understand the expectations when we're delivering programs with fidelity. We need to be thinking about who are our service delivery partners that help us build readiness in our own network to do this type of work, let alone across organizations out in the community. And then these programs that are evidence-based, and what brings probably most of you to this call today, they require ongoing data collection, reporting, quality improvement, because we want to see those improved health outcomes in individuals who are coming to AAEBIs. And that's going to be really critical for your program and your organization as you're thinking about your readiness to take on a program. So if we go to the next slide. We see all of our program implementation with this foundation and these three pillars. And can you send someone to training and pick up a program and launch it tomorrow? Probably. Can you do it with an equity focus? Can you do it with partners and collaboration? And can you do it sustainably? Potentially not, without some really intensive organizational thought and effort put behind your organization's ability to do that program long term. These program models and the relationships that you build, whether it's with healthcare to drive referrals, the community to make sure you're reducing some of those barriers to participation, and or the sustainability of your program models, require you as an organization to be very thoughtful about what construct you have in order to support this program long term. We many times programs, whether it's AAEBIs or in other spaces, end up being very grant dependent in the nonprofit world and in the community-based organization world. And while that's great, right, we appreciate having resources from our partners like CDC and others. If we're going to be building trust with community, if we're building trust with our referral partners and our collaborators, we do not want these programs and services to end when the grant ends, right? How many times have you potentially yourself been a part of a program or seen it in the organizations that you've been in, where you've had this great model and then the grant ends and the program ends? And that is what we have intentionally really tried to focus on in the YMCA, is to make sure we're not doing that, which is why we spend a lot of time in preparing YMCAs to launch programs focused on these pillars. And if we go to the next slide, we in the YMCA have developed what we call a readiness assessment, which focuses, and what we're going to talk about now through the remainder of our time, are the components of that organizational readiness for a program. I'll be very transparent. This is really about sort of program or service readiness. It is not readiness to do a grant, right? That's a different set of criteria on top of this. This is about like, is your organization ready to take on an additional program or service? And we broke down our framing around this into 3 categories, really looking at these components of organizational readiness. Partnerships and collaboration, especially if you're about to deliver a program for which your organization is not necessarily known for in your community. Your organization's capacity to do this and maintain it. And then the support of individuals who are going through behavior change. Oftentimes we call those individuals in the YMCA health seekers, but it's really that's the audience that we're working with when we're thinking about how we actually support these individuals we're trying to reach through behavior change, both within your organization and potentially beyond. So like all good things, we have 3 categories or 3 components, but if we go to the next slide, you're going to see 7 key organizational capacities, and hopefully, 7 key organizational capacities that fall under those 3 components. So in partnerships and collaboration, we focus in on community partnerships, which may be with healthcare, but oftentimes are, we want to think more broadly, as well as the healthcare provider or referral in systems that can help support bringing people into the programs. In the organizational capacity component, we're looking at, is your organization's leadership engaged and supportive? How is your organization prioritizing diversity, inclusion, and health equity? How is that essential and not just a lens by which you're doing the work, but the foundation of which you're doing the work? How much have you delivered an evidence-based program before? What's your program implementation expertise that might require data entry in a timely manner and things like that? And then what is your focus in sustainability planning when it comes to that program model? And then when we're talking about support of individuals who are going through behavior change, we talk a little bit more about that in that bucket as well too. So we have several kind of key capacities that we're looking for in the why, but we think most organizations probably need to ask themselves as they're preparing or thinking about delivering a program. So if we go to the next slide, I'm going to talk a little bit about partnerships and collaborations, and then Mamta's going to jump into the next one. So why is it critical to work with partners? I'm hoping that nobody on this call doesn't see the value of that to begin with, but there's a couple things that we've really focused in on when it comes to understanding this within the YMCA. One is, if your organization is not already known either with the community that you're trying to serve or known as a provider of this type of service, it's critical for you to build, partners can help build that credibility. The other thing that can be very helpful for your organization is partners can help optimize your impact, right? We want to be thinking about how can we be connecting to people? How can we help continue to advance the work that you're trying to achieve by partnering with different organizations? If your organization isn't known and doesn't have trust within the community that you're trying to reach, you're going to need partners in order to have that the most impact that can be achieved. And then partners can also help potentially expand your financial support for the program. One thing that is critical to your, as an organization, thinking through what your next steps will be when you're coming to partnerships is you need to think about the community you're trying to serve as a partner to. So do not, hey, you might look around the community and say, nobody has enhanced fitness or nobody in this community has walk with ease. Okay, that's great, right? That already that these programs might not be available in your community. But you first need to also then understand, is the community in need of another AAEBI? Is the community in need of a program model that allows them to do something on their own, like walk with ease self-directed as an example? In that case, you're thinking about the community as a partner from the beginning, so that you're not just saying like, ooh, there's an opportunity for us to bring a program here. We can just do that, right? You could, but you may not have the impact that your organization could, if you're not thinking about the community you're trying to serve as an essential partner to the conversation to begin with. You may also have an opportunity to bring, we'll use enhanced fitness as the example, enhanced fitness to your community, but there are already 4 other enhanced fitness service providers in your community, and that need's already being met. Does it make the strategic sense to do so? So part of what we want to help organizations think about isn't just the opportunity you have as an organization, but the partners and the community you're trying to serve. Is this a need, and can this program help address that need? You can't do that in isolation. You have to do this with partners. So if we go to the next slide, in addition to thinking about how you're, some of the benefits, we want to make sure that we're thinking about how your foundation with this partner is mutually beneficial for both organizations. It can't just be about how a partnership can support your organization. It has to be how you advance each other's work. Again, we talked a little bit about this earlier on the previous side, but having partners can help drive awareness and identification of additional organizations and/or individuals you might need to engage. Thinking about where these programs and services might be, located can be something that your partners can help you. And then obviously, if we're thinking about partners as well as clinical partners, then looking at how you're exchanging information and that bi-directional communication is going to be really important. This talks about bi-directional referral pathways, but it may not just be about referrals. It may just be also that communication piece. Earlier this week, I spoke at an event around social determinants, and one of the things that we talked about was the fact that oftentimes when it comes to partnerships, if you do not extend your partnerships as far into the organizations as possible, when there is staff turnover in either partner organization, it's a huge disruptor to the progress that you might have been making. So when I say that as an example, I mean, if we're working with a partner organization, we're trying very hard to not just have that relationship sit with one person, but instead multiple people in the organization are talking at multiple levels. So that way, if there is turnover, hopefully you can try to minimize the impact of that disruption as possible. The next two slides, and if we go to the next one, I can talk a little bit about referral systems. So we talked about the partnership part. The referral part can also be really critical for your organization to look at, and some key questions here that we have listed. So one, does the community recognize you as the solution, right? I've said this before, but that's really critical. Do healthcare providers already refer to your organization? And if not, how might you start to think about that? And, if you're an organization that typically has, put up a flyer and you've gotten a lot of people into your program, that is amazing. But not all programs, maybe that is the way in which you can fill your classes. So instead, you need to think about how do you go beyond traditional strategies for recruitment to bring people to the program or make them aware of the program. And we spend a lot of time in the YMCA focused on building a robust referral network, especially with the healthcare community, as a way in which we can help them understand that we can be a resource to their patients when it comes to the health improvements that we're both trying to see, especially around arthritis management. So the next slide talks a little bit about that bi-directional referral process. Mamta and I could both probably lead a whole day-long institute talking about some of the things that we've learned in this space. I promise you we're not going to do that on this call. But this is just a snapshot of how you can think about bi-directional referrals. And we very clearly talk about these as bi-directional. You can build a lot of relationships with healthcare partners to get people into your programs, but your physician partners and maybe it's the CHWs you're working with, other types of clinical partners, they want to know, did somebody actually come to the program? They want to know how that individual did. So it really needs to be a two-way communication with those agencies or individuals in order to help them think through how best we can not only get individuals to be aware of the program, go ahead and make the referrals, share patient progress so that monitoring can happen. And in some instances, your organization might identify people who need clinical care. So then how are you helping to get that individual navigated to resources in the community to best support them in their long-term health journey? So we really want to think about referrals as not just referrals into your program, but you may identify individuals who are going to need services that your organization doesn't provide. Again, the partnerships that you can develop can help address that. But you want to think about then how do you get people back to those resources and or connected to care to help them meet those health needs or the other needs that they might identify through your programs overall. So with that, I'm ready now to turn it over to Mamta, who's going to talk a little bit more about organizational capacity and then also about that behavior change support, which we know are critical components to readiness at the organization level. So I'm turning over to you,
Cool.
Mamta.
Thanks, Heather. So hi, everybody. Again, as you heard in the intro, my name's Mamta, and I work closely with Heather at YMCA of the USA. And I just moved. I know you all needed to know that, but just apologies if my internet gets a little wonky because we're still working on setup. So I just wanted to put that out there. But I'm going to talk, as Heather said, a little bit about organizational capacity, which is tied into how we frame the organizational readiness for the Ys that we work with. And as Heather also mentioned, we have a tool that we call a readiness assessment that reflects all of these categories, and it really is engineered to serve multiple purposes. One, to help Ys that are connecting to programs like AAEBIs or other evidence-based interventions get a picture of what are some of those crucial elements for for standing up programs that are both sustainable and successful, but also for us understand a little bit about what, and so that's something that you can be thinking about too for all of your organizations is how this is not necessary to say that there is a specific formula of readiness, but like how does readiness shake out, and how could you evolve readiness and capacity to support programs like AAEBIs? So next slide. One of the components of organizational capacity that we've observed to be so important to the success of program implementation is really having engaged organizational leadership, whether that's folks at the C-suite level, however it's framed in organization. Having that buy-in is helpful for multiple reasons. One, because that leadership is often going to be who are the drivers of your efforts to support the health and well-being of your constituents, whether that's folks that you have regular relationships with, or if you're trying to build pathways and relationships in the community to serve more individuals. That active leadership engagement is aligning to your missions, to your strategic plans, ensuring that efforts aren't siloed, that you're really thinking about how to not only prioritize program implementation, but that you're integrating those program operations into existing scopes of work and other operations. Can help streamline usage of our work. Can also help to elevate the program to increase external visibility, as leadership may have relationships with partners in the community that can help you as you're trying to create those collaborations. And as Heather said, that network of support for your participants. To help ensure organizational buy-in from organizational leadership, it's really important, at least that what we've observed in the Y, is that those leaders need to have a really clear understanding of what it takes to run programs like AAEBIs or other evidence-based programs, having a sense of what those standards are, what the requirements are, what the needs are from a staffing perspective and a financial perspective to help to ensure successful and sustainable implementation. Next slide, please. So I know there's a lot on this slide, so I'm not going to read it all, but Heather talked a lot about this. It's so important that we think about, in order to really have an impact in our communities, that we're thoughtful about both diversity and inclusion and health equity, and for multiple reasons. So one of the things Heather talked about early on is that we're not making assumptions about what the communities need. Communities where we operate, yes, we might identify because there's a grant opportunity, or we've determined there are no enhanced fitness programs, so we want to stand one up. But what we try to do, and as we support local YMCAs, is making sure that we're checking those assumptions, that we're working with the communities that we aim to serve to determine, as Heather said, for an example, is enhanced fitness really what they need? Is Walk With Ease group what they need? Or maybe they want something that's the self-directed or the self-directed enhanced. So assuming that collaboration, those conversations, that voice has been reflected in our planning, the next step is to really make sure that we are reflecting the communities that we aim to serve, that we're thinking about how we can improve the health of our communities by identifying where and who might be underserved by existing resources, and that we are also thinking about how we are best meeting their needs, whether it's by diverse hiring practices, thinking about who's actually going to be the instructors or the frontline staff who are facilitating these classes. I'm sure many of you on this call have heard that saying that change happens at the speed of trust. And what's so key to building trust is making sure that the people that we hope to serve see themselves in what we're trying to do and see themselves as part of the whole. So that's part of why we talk about as a function of readiness, where WISE are in terms of their practices around diversity and inclusion and health equity, and that we're being thoughtful about, even if maybe we're not, we haven't gone as deep as possible yet, that we are building pathways to get there and that we're not just checking a box. And the other thing I'll just point out here is that there is a lot of things that, there are a lot of different dimensions of diversity, and there's a lot of different ways that we can think about addressing health equity. It's not just always scholarships. And that's something that you hear a lot of, especially when we have grant funding. We have grant funding that can subsidize program fees. That's great. That's one way to hopefully help people who don't have access to disposable income participate in services and programs. But we can also give of race, of ethnicity, of gender, of age, thinking what we've seen a lot through the pandemic with a lot of social participants. So we spend a lot of time layering in these conversations around health equity, around diversity and inclusion, and help seeding some ground so that, as Heather said, this becomes the foundation for all of our program implementation efforts. Next slide, please. Program implementation experience. On a previous slide, you saw how we think about the evidence-based interventions a little bit more rigor around, and actually I just got a note from Heather that my internet's glitchy. I am going to go off camera just to make sure that I can keep it going. So apologies for that. So we want to help organizations think about both what they have to plan for in terms of being able to really support a program that is rooted in a strong evidence base, and how they might build upon prior experience. So thinking about how if you have a program that is designated for a specific population that meets certain clinical criteria, or have one or more risk factors for, or as you see on the slide, an actual diagnosis of a chronic disease or condition, that's going to influence how you market your program, how you approach participant recruitment and retention. It's going to influence how you think about the entire enrollment conversation, the types of information that you need to collect on participants and store in whatever data platform that you're using. So you'll want to think about, from an organizational preparedness perspective, the ability to devote the requisite time, energy, and resources to making sure you have practices that ensure that you have the ability to capture this information, that you have the ability to do quality improvement, to review data, to assess how things are going, and to make improvements over time. And that you have the ability to protect the privacy of participants because you are collecting certain clinical and other health information, so that you have those standards and practices in place, and that can help you meet the rigor that is required for a lot of evidence-based health interventions like the AAEBIs. Next slide, please. We talk a lot about program sustainability. What does that mean? So it's thinking about how, when we are really trying to have an impact on the health and well-being of our communities, that we have services that are widely and consistently available. And that requires both operational sustainability, so thinking about having staffing sustainability, having organizational buy-in, having alignment across departments within an organization, essentially having the infrastructure that will reliably support quality program delivery, as well as financial sustainability. So thinking about the business planning around your programs and services, and having a long-term plan in place that supports program launch, being like the the runway to program launch, delivery, and ideally growth over time. And that is how we talk about sustainability. There's a lot that can be unpacked here, but that it crosses both of these buckets, both operational and financial. Next slide, please. So when you're thinking about sustainability, some ideas for where to focus: staffing models. So making sure that you have enough staff, the right staffing model to meet the needs of your community, like what you actually aim to achieve in terms of number of classes you might deliver, number of people you hope to serve, and ensuring that all staff have the requisite skills and knowledge or access to training that will support their different roles and responsibilities. Heather talked about turnover. We cannot stress how important it is to think about succession planning, making sure that program knowledge doesn't just live in someone's brain or even on someone's desktop, right? That you're really thinking about, because staff transitions happen, right? That we want to make sure that as much as possible, the penetration of this information in the organization goes as deep as you can, so that there wouldn't be a disruption in continuity or a disruption in partnership, like Heather signaled, should someone leave. Thinking about your program budgeting and financials, really putting some thought into understanding actual program costs. So even if programs are offered at a low rate, even if they're offered at no charge, right? There's still costs to program delivery. There always will be. So making sure you understand what those true costs are and creating a business plan around it that can support multiple revenue and funding streams. So grants are great, yes, and that can be considered a funding stream, but not one that would be sustainable over time. So how might you incorporate self-pay, participants paying fees for the program, or if you have contracts with, local employers who want to get access for their employee populations to these services, or payment models that are actually connected to private and public health plans as well. As I mentioned before, thinking about organizational leadership engagement and not only helping to keep the visibility of these services high and consistent and spread throughout the organization, but also helping to gain access to partners in the community, collaborators in the community, where they might have those relationships, aligning efforts with any sort of strategic plans or strategic imperatives, and then thinking about what's so critical for programs like this is how we're ensuring that we're achieving impact through data collection and through ongoing quality improvement. Next slide, please. So the final bucket that we have integrated into our approach around organizational readiness is really about the participant, how we can best support the program participants that we hope to work with through the process of behavior change. Next slide, please. So there's a lot on this slide, but a lot of it is, repeating themes that we've talked about. Really, it's what comes down to it, and this is probably no surprise for everyone on the call, it's all about relationships, right? How do we think about how we're building relationships with individuals that we hope to reach, with community organizations and community members, through our communication channels, through group facilitation? That's really what is at the heart of our ability as community-based organizations, as nonprofits, et cetera, to meet the needs of our community members through program implementation. And so thinking about how we can identify those potential program participants and make sure that they feel supported through the very difficult process of behavior change. Heather mentioned this. We talk about population, we use the term health seekers. It may be a term you're familiar with, it may not, but really it's just thinking about how those individuals, which is really all of us, the choices that we make to be healthy and live well, and the choices that can be difficult to make, sometimes because of things that are outside our individual control, right? And you go back to the Kaiser's framing around social determinants. There's a lot of inequitable distribution of social determinants that make it very difficult for people to access resources, to live their healthiest lives. And so how do we support participants as they endeavor to work on behavior change? And so this ties back to how we support our staff and how they're trained to understand the individual wants and needs of participants, their interests, to meet them where they are in their behavior change journey, because it will be different from one person to the next, and to help to share accountability for that behavior change. And we also want to think about how we're supporting participants, not only in the programs, the AAEBIs that they may be connected to, but also in other opportunities. Like, what are those wraparound supports that we can be thinking about as participants continue on that behavior change journey? So we say all that because a lot of it is relationships, right? It's so much about that organizational relationship, that individual relationship, but you also want to think about the social and physical environment that your participants are going to be experiencing and how that might facilitate or be a barrier to their behavior change journey. So thinking about if you're doing virtual classes, for example, how you make sure that people have access to internet or have access to equipment. If you're thinking about where you are going to have classes in your facility, what's going to be something that's going to lend itself to relationship building, but also participant privacy. So there's a lot of things to think about, both in the environment, whether it's a virtual, social, physical environment, that can influence our ability to really connect with the individuals in our programs. Next slide, please. Okay, so program implementation. So everything that we've talked about that we have identified as key for readiness, and it's part of our readiness assessment. It's part of the pathway that WISE that want to connect to programs like AAEBIs will participate in, but it's also how we stage program implementation. So next slide. We talk about program implementation as it's really kind of a capacity building and preparation for launch that is the runway toward program implementation. So Heather talked about this earlier. It's, yes, you could pick up a program manual and get trained in it. And then could you launch a class? Maybe, possibly, but we really think about program implementation to be really thoughtful and intentional around it. It takes some time, and where we've seen in the WIDE network, sometimes up to 6 to 9 months of really intensive and intentional preparedness to set a foundation for a successful program that is more likely to recruit participants, to keep those participants retained in programs, and to see some sustainability. And so when we have WISE that are entering the space, they've determined with their constituents that the need is there, they've assessed their readiness, and they're ready to move forward based on that with program implementation, then we go through a launch process that mirrors a lot of that, where it's step one is really setting the stage, thinking about developing a support team, how you'll either enhance or implement some approaches around health equity, understanding the need from a chronic disease perspective in the community, how you're going to think about supporting participants. And then you layer on additional strategies or activities from that foundation. So how are you thinking about supporting and engaging program participants? Who are we aiming to serve? How will we build relationships with those participants? How will we connect with them? What are the partnerships that we have to have in place in order to gain entree into those communities? And what might their experience be in terms of their access to services that we might be offering? And then another layer is thinking about, through program reach and impact, how we can ensure sustainability. So that's where we focus on specific preparations for program launch, continued engagement of our community partners, understanding our practices around data management and program quality, and continuing to seed the ground for sustainability. And then we get to the period of where we're actually launching. So we really think about the entire pathway, as I said before, could be 6 to 9 months. And that training of frontline staff is one of the final pieces. We want to have all of this groundwork and foundation built before we actually have folks attend trainings. So there's not a gap between their training and when they actually are working with participants. So program implementation or program launch is sort of that last stage. Next slide. And the final thing I'll share before we give a little bit of time for some discussion is we have found that a team approach has been really helpful in WISE being able to deliver these programs with that intentionality, both from the perspective of ensuring, again, that there's enough institutional knowledge to really support this work, but also because there's just so many different perspectives and so many different access points that that different members of your organization might have skill sets or might have relationships or might have talents that can really contribute. And so we really think about a team approach, whether you call it a advisory committee or a work group or a project team, it's thinking about, what are those key program functions, whether you have the project management, the executive leadership, your actual frontline staff, the staff that are going to support partnership engagement efforts, the staff that are going to support those relationships with healthcare and thinking about that, referrals in and communication out, board members or volunteers that again might have some community relationships that can enhance your work. These could all be the same individuals, they could all be different individuals. It's really important just to think about what those key program functions are, and they're listed here and they reflect some of what we talked about, but just something that we have found, and I wouldn't be surprised if your organizations have found that too, that having that team-based approach can really help to make sure that you have those various disciplines at the table, but also making sure that you're thinking about the approach with organizational capacity, organizational alignment in mind, and making sure that you're setting up your teams and your organization for successful program implementation. So I think that's it in terms of slide. Yes, okay. And Heather, if there's anything that I missed, again, apologies for my internet glitchiness, but anything that you would add for that section before we post some questions to the group?
Nope, nothing else. Great.
Okay, so I think
we have a question. Clarissa, do you want to ask it? You want us to?
I can go ahead and ask it. I just once again want to say thank you so much to Mamta and Heather for this informational presentation. And again, if you all have any questions, please feel free to unmute yourself, raise your hand, or put your question in the chat. But I do have one question. How has your organization worked with communities to determine readiness?
Yeah, we just love to hear from all of you about how you've been working to make sure that there's need and readiness in your community.
I will say something. I'm Shanetta with I'll turn my camera on so y'all can see me as well. Okay, here I am. I'm with the Arkansas Department of Health. I'm the Arthritis Program Manager. One thing I've been striving to do is to meet monthly with my contracted partners. As the program manager, helping them feel that they can trust me as, the overseer for them. And really in those meetings, giving them information from the agency level, CDC level, and then also asking them what are their challenges or weaknesses within their communities. And hopefully, I can get to have the opportunity to see some of them in action. So that's a personal goal of mine. That's one thing that we're doing to make sure they're ready and they have the support that they need from the state level.
Great, thank you for sharing. It's about the relationships that you're building.
Hello, this is Angela Holtberg, New Rochelle YMCA. I am an instructor and I teach silver sneakers, I teach Tai Chi, I teach Zumba Gold, I teach Zumba toning, I teach Aqua Zumba, I teach better balance, I teach all kinds of things that I have access to many, many people. And it's been a very, very fun opportunity to reach out to everyone wherever their needs are, because I have discussions with individuals, quite often people with questions, people have needs. And so it's a great, big, gigantic open door for me to present some of these dreams that we have in our little miracle way to see them come to pass and to provide services for people. So for me, that has been my best access, and looking forward to more opportunities.
Thanks, Angela. You sound like a busy person with all the classes, but I think, again, a great example of how just by virtue of the relationships you built with the individuals you're serving, you get a sense of where their needs are starting to emerge and how, in your case, the YMCA and or your organizations can work to address and connect people to those resources. So thank you so much for sharing.
Heather, this is Wendy Farthing with Maryland Living Well Center of Excellence. And I was wondering if you had any suggestions for organizations that, if you want to reach out to, say, Y of Central Maryland, if you have agencies that are not currently offering all of the variety of arthritis programs, to have them partner with your agency, like what they're looking for in a partnership?
Yeah, great question. Thanks for asking that, Wendy. So yes, if any of your organizations, agencies, et cetera, are interested in working with YMCAs, I definitely would recommend reaching out to, a great place to start obviously can be with the health and wellness directors. The leadership team at the YMCA can also be helpful. I think, even thinking about if without understanding all the dynamics there in the Baltimore, Maryland area, but like if you have some organizations who deliver some programs and some doing another, oftentimes our public health partners, as the neutral conveners, are good to bring all the stakeholders together and say, okay, here's, let's look at our inventory, what's being offered, who's offering it, what's happening in the next year. We've even been doing an inventory ourselves with YMCAs to sort of say, hey, how many of you are going to be offering these programs over the next year, so we can understand what the needs are in the network, et cetera. I think doing that across the various, organizations and agencies in your communities who are trying to all address arthritis, with the list of AAEBIs continuing to expand, you might want to start thinking beyond even some of your traditional. There's obviously a group of AAEBIs that are focused on physical activity or exercise, but starting to get into more of the behavior change and behavior interventions, you may start to think about sort of, different types of organizations also that can participate and potentially help you address the needs of your community. So I think, at the local level, reaching out to those health and wellness directors or leaderships at the YMCAs can often be helpful. And then thinking about how you might convene a large group of stakeholder organizations to help address arthritis within your community. Oftentimes, whether it's public health through the departments of health or through other agencies, can be those conveners to sort of say, how do we help make sure we have a continuum of services available around the community.
Thank you.
Right. Well, thank you for the great questions, everyone, and the great feedback. I enjoyed hearing what some of the things you all are doing in your own communities. So hearing none, that we just again want to thank Mamta and Heather for this great presentation, and we hope you all had a wonderful time listening in. So just a few quick Sophie notes. We value your feedback, and we ask you to complete the evaluation that would be emailed to you following today's webinar and will be posted in the chat. I think my colleague Jade will be posting that to the chat very shortly. And your evaluations of this webinar will, of course, assist us in planning any future webinars. So once again, thank you for completing that for us. So on behalf of Sophie and to our presenters and our participants today, this brings our presentation to a close. This presentation, once again, is recorded and will be archived within 24 to 48 hours on Sophie's YouTube page, as well as our eLearn core page. And please take a moment to again complete the webinar, and the link has been posted in the chat. So once again, thanks everyone, and I hope you have a fantastic rest of your day.